5 choices focus on the resistance mechanisms of increased efflux and decreased uptake, particularly for tetracyclines, sulfonamides, and fluoroquinolones. Question 1. Tetracycline resistance. A 29-year-old woman is treated with doxycycline for Chlamydia trachomatis infection. Despite good compliance, repeat testing shows persistent infection. Which of the following best explains this bacterium's resistance to tetracyclines? A. Enzymatic hydrolysis of the drug. B. Methylation of the ribosomal binding site. C. Increased drug efflux from bacterial cells. D. Mutation of dihydrofolate reductase. E. Inactivation by acetyltransferase. Correct answer? C. Increased drug efflux from bacterial cells. Explanation: resistance to tetracyclines like doxycycline often results from efflux pumps that actively remove the drug from the bacterial cytoplasm, preventing it from binding to the 30S ribosome. 8. Beta-lactam resistance mechanism. B. Methylation is for macrolide resistance. D. Seen in trimethoprim resistance. E. Seen with aminoglycoside and chloramphenicol resistance. Question 2. Sulfonamide resistance. A 45-year-old HIV-positive man develops pneumocystis pneumonia and is treated with TMP-SMX. However, E. coli isolated from a concurrent urinary tract infection shows resistance to sulfamethoxazole. Which of the following mechanisms most likely explains this? A. Enzymatic destruction by sulfatase. B. Mutation in the PEBA binding site of dihydroapteroate synthase. C. Increased affinity of bacterial ribosomes for the drug. D. Inactivation by chloramphenicol acetyltransferase. E. Beta-lactamase-mediated cleavage. B. Mutation in the PABA binding site of dihydroapteroate synthase. Explanation: sulfonamide resistance often occurs due to mutations in dihydroapteroate synthase, reducing drug binding. Increased efflux and reduced uptake can also contribute, but are less common. A. Not a known mechanism. C. Ribosomal binding affects protein synthesis drugs, not sulfonamides. D. Acetyltransferase affects chloramphenicol. E. Beta-lactamase is irrelevant to sulfonamides. Question 3. Fluoroquinolone resistance. A 62-year-old man is diagnosed with prostatitis caused by Pseudomonas aeruginosa. He is treated with ciprofloxacin, but the infection persists. Laboratory testing reveals that the bacteria are resistant to fluoroquinolones. Which of the following is the most likely mechanism of resistance? A. DNA methylation. B. Ribosomal RNA cleavage. C. Decreased permeability through porin channels. D. Inactivation by beta-lactamase. E. Inhibition of adenylate cyclase. Correct answer. C. Decreased permeability through porin channels. Explanation: Pseudomonas and other gram-negative rods often develop resistance to fluoroquinolones through reduced uptake via loss of outer membrane porins and increased efflux pumps. A. Methylation applies to macrolide resistance. B. Not a resistance mechanism for fluoroquinolones. D. Beta-lactamases act on penicillin cephalosporins. E. Not related to antibiotic resistance. Would you like